Thank you. So this week we're gonna continue. So last week we have reviewed those release exterior and the purging. So two excess condition treatment formulas, and this week we're starting from harmonizing. Okay, looks like we're all here. Ashley, can you read this page, please? Ashley, can you hear me? Maybe not. Okay. Donna, can you read this page, please?
Okay. 18. 小柴胡汤 Minor Buplurium decoction 柴胡黄芩半夏人参 HTCG 烧
Okay. Donna, can you stop this? Too much noise. I can hear Dr. Chai's voice too.
Sorry.
Yeah. Okay, maybe. Melanie, can you read this page, please?
Yes. 18. Xiao Chai Hu Tong. Minor Bilarum decoction. Chai Hu Huangqin Banxia Renshen. Xiaoyang stage symptoms. Alternating chills and fever, exterior. Bitter or sour in the mouth and dry throat and dizziness, interior heat. Heartburn, nausea, vomit, reduced appetite, gallbladder, attacking stomach, spleen. String top pulse. Qi deficiency, Renshen, qi stagnation, Chai Hu, damp phlegm, Banxia. Heat, Huangqin. Due to its ascending action, it can cause headache, dizziness, and bleeding gums if taken long term.
Thank you. So yes, this harmonizing is they harmonize like interior, exterior, or harmonize like other organs like liver and spleen, or stomach and intestine. So basically, the harmonizing is compared to previous two categories of release exterior and purging, this is rather mild treatment. So the harmonizing can be just harmonizing of yin and yang, but also harmonizing can be more mild treatment. So there's another meaning of harmonizing. So Xiao Chai Hu Tang is the most well-balanced formula in a sense that this is a Chai Hu Huangqin Banxia Renshen, very simple, the Shangren formula. SDGD is Sengjiang Daze Zigan Chao, basically. So this treats the Xiaoyang symptom like alternating chills and fever. So alternating chills and fever is actually, there's some error here. So alternating chills means that pathogenic factor is escaping to the outside, you feel chills. When they're going to interior, there's fever. So this is exterior and interior. So that's not only exterior, this is exterior and interior condition. that the pathogenic factor is staying in the Shaoyang level, so it's not exterior, not interior, in between, and they kind of move around. Bitter and sour in the mouth, dry throat, and dizziness. So bitter taste is actually a gallbladder. So this is like gallbladder is raising. I mean, gallbladder is going up due to the qi stagnation. You feel bitter taste in the mouth. Sour taste in the mouth is the gallbladder attack the stomach, then have a sour taste. So taste of the liver is, in terms of 5 elements, taste of liver is what? The taste of liver. Taste of liver is sour. In terms of 5 elements, taste of liver, taste of wood is sour. But there's in physical body, the liver is not causing sour taste. Liver heat make a bitter taste, but liver attack the stomach, then have a sour taste. So that like a little bit difference between 5 elements and the organ. And the mouth dry, and the dry throat, this is all like the interior heat and causing the rising yang, dizziness. And also attack the stomach and heartburn, nausea, vomit, and reduce appetite. And the string thought. So this is a 4 key characteristic of the Shaoyang syndrome. The beauty of the Shao Chai Hu Tang is that they can treat qi deficiency with the Renshen, and then the qi stagnation, Chai Hu, is very common, right? Qi deficiency with qi stagnation. And if qi deficiency and the qi stagnation is there, the qi stagnation cause heat, right? Depressive heat. So you can treat it with the Huangqin, so you can clear heat. And qi deficiency cause phlegm and damp, so you can treat the Bansha. So basically, it can not only treat the Shaoyang syndrome, it can treat the like a liver qi stagnation with the spleen qi deficiency, with minor heat, like a depressive heat, and some phlegm and damp condition. So that's why it is very well harmonized. That just due to stress and the like overwork, you don't feel a little bit heat sensation, a little bit nausea, lack of appetite, and maybe have some the bitter taste or sour taste. And this is a formula that we can recommend, right? So, and this is also very important formula for children as well. And Chai Hu tends to raise qi, so if you take a long term or like overdose, then they may influence the upper part, causing headache, dizziness, and bleeding gums. Take a long time. So Shao Chai Hu Tang is one of the Shaoyang alternating treatment fever. But even without alternating treatment fever, you have a general the signs and symptoms of qi deficiency with the qi stagnation and the phlegm and damp and the heat. We can still use it. Okay. Next one is Nisan. Mia, can you read this page, please?
Nisan, frigid extremities powder. Chai Hu, Zershir, Bai Shao, Zhergan Sao. Cold fingers and toes while the body and head are warm. This may be accompanied by a sensation of irritability and fullness in the chest and epigastrium, cough, urinary difficulty, abdominal pain, and severe diarrhea. Red tongue with a yellow coating and a string taut pulse. Heat entering interior to constrain the yang qi, yang jui. Liver qi attack stomach, hypochondriac pain and distension, bitter taste, nausea, belching, reduced appetite, fullness in the chest and epigastria, interior heat, spleen 4 and pericardium 6, plus Tao Hong, Si Tong, and Shui Fu equals Shui Fu Ju Tong. When coughing, add Ganjiang and Wu Weizi and Raynaud's phenomenon.
So Sunisan is one of the common formula on the exam. Very simple, just like other Shannon formula. It's 4 herbs like Chaihu, Jishi, Baixiao, and Jiganchao. So this Ni means like frigid extremities. So Chaihu is one of these cold extremities due to qi stagnation and constrained heat. Because qi is stagnate, especially these qis, they kind of obstruct gathering qi, zong qi in the chest. So that your gathering qi is not spread towards the extremities, you usually feel the cold finger and toes, while the other part has rather warm. Even tongue is slightly yellow coating because this constrained heat or depressed heat causing some heat sensation internally and the wiry pulse. So this one, like again, qi is constrained in the chest, in the gathering qi. That gathering qi is not spread to the extremities. You feel cold fingers and toes. So this is kind of false cold and true heat, right? So this is accompanied by sensational irritability and fullness in the chest because the heat agitates internally, like in the lung and heart. So feeling of this fullness and irritability in the chest and epigastrium and cough. So this is all like due to qi stagnation happening in the upper and maybe going down. So, but more like a problem is more upper condition. So tongue is red with yellow coating and the string top pulse. So this is like one of the Jue syndrome. We have a Yang Jue. This is we have a Yin Jue. That is what I call this. Another is Ru Jue. That is what. So this is all like cold extremities. For example, Sinitang is not only the finger and toes, whole limbs can be cold, right? Because it's kidney yang deficiency. So that we say injue. And the ru means heat. So dacheng chitang, this is extreme heat, yangming heat, obstruct like yang qi going to the extremities. Your patient feels cold. So between, that's strange. I only do the 60 minutes, how come there's only 29 minutes left? Anyway, so this is one of the Jue syndrome, but this is subjective cold. So if you touch this Sunisan patient hand, but fingers and toes, it is not really cold. Maybe slightly, but not like cold as Sinitang. But patient feels cold. So this is one of the Raynaud phenomena, cold extremities. This is the things that they may ask in the question, right? And so I didn't open this 15 minutes earlier. I opened this like 2 minutes earlier. So this is actually 18 minutes is what I opened this class. Anyway, okay. And this is another thing that we can do, like a Sunisan, is that they also liver attack the stomach. So this is another common indication, wood overacting on the earth. So they may have this hypochondriac pain and distension. Hypochondriac distension is main symptoms of the liver qi stagnation, right? A bitter taste, or nausea, belching, reduced appetite. And the fullness in the chest and epigastrium is also a qi stagnation in the chest. So if the chest is obstructed due to qi stagnation, blood stasis, we use aspirin 4 and pericardium 6. This is 8 confluential point combination of Chong and the Inwei. And also Sunisan plus Tao Hong Siu Tang. This is like a Shefu Tang. So yeah, Shefu Tang, yeah, we're going to study this in the blood stasis formula. But yeah, this is a good indication that the blood stasis, in this case, Shefu Tang is blood stasis caused by what? So Shefu Tang is a blood stasis in the chest due to chi stagnation, right? Yeah. So because of the cause of blood stasis is many. It can be chi deficiency, can be chi stagnation, can be blood stasis. Can be blood deficiency, blood heat, or cold, internal cold. So depends on what cause of blood stasis, the treatment should be differentiated. So Shefu Tang is a very clear example that blood stasis in the chest due to chi stagnation. And if the cough, the liver attacks the insulting the lung, because this is a very common condition, liver insulting the lung, then you add 간장 and uweizi, because 간장 is, even though it's warm, it has a strong function to stop coughing, transforms phlegm, and descending the qi. And this is an uweizi astringe and stop cough. So this is modification questions. And this is Raynaud phenomenon that can treat this cold extremities diseases. So this Sunisan is Sunisan is more excess condition. Sunisan is more excess because the tongue is red and the yellow coating, so it's heat with the depressive chi stagnation, depressive heat is the main concern. Whereas Xiao Chai Hu Tang is more balanced of excess and deficiency. Okay. So any questions of Xiao Chai Hu Tang and Sunisan? So again, the spleen 4, pericardium 6 is a good point for open the chest, right? Together with the RAN 17. Next is Xiao Yao San. This is one of the most popular formula in our clinic. The famous Xiao Yao San. Ruth May, can you read this page, please?
Yes, sir. 逍遥散、柴胡、当归、白芍、白术、茯苓、炙甘草 plus 微姜、薄荷 hypochondriac pain, vertigo, bitter taste in the mouth, dry mouth and throat, fatigue, reduced appetite, pale red tongue, string taut and deficient pulse, liver qi overacts on spleen cause spleen deficiency or spleen qi deficiency, not supply enough blood to liver cause qi stagnation. Liver qi stagnation, 柴胡薄荷 plus deficiency, 当归白芍 qi deficiency, 白术茯苓 harmonize, 炙甘草微姜 with a heat sign, 加味逍遥散 add 牡丹皮栀子. Thank you.
So Xiao Yao San, as we know, very important formula to treat the spleen and the liver disharmony. Right? Spleen qi, liver qi attack the spleen, becomes spleen qi deficiency that causes slightly blood deficiency. So that's very common condition, right? So the Chai Hu Bai Xiao is the same as Sunisan formula, because it is one Chai Hu Bai Xiao there, right? And then add the dangui 25, dangui and baishao for nourished blood, and baizu fuling is for the qi. So this is another well balanced of qi deficiency with blood deficiency with the liver qi stagnation. And Weijiang is like helping the stomach, middle jaw. And the boho is actually like a clear heat, vent the heat, but this is also important herb for like liver qi stagnation. But if qi deficiency is severe, then do not use boho because they like release exterior may damage the qi further. So depends on the patient qi. You can use boho or adjust the boho. So yeah, typical liver qi stagnation, hypochondriac pain, headache, vertigo, because this is more like a qi stagnation going upper. It's not necessarily liver rising, but excess qi stagnation can cause headache and vertigo. And bitter taste in the mouth. Again, this liver attack the spleen, stomach, and this is heat, actually heat in the qi stagnation, and dry mouth and throat. So this is same as the Shaoyang syndrome, bitter taste, dry mouth and throat. And then fatigue and reduced appetite is a qi deficiency. And like a little bit pale tongue is blood deficiency. Right? So liver qi overactive spleen and spleen qi deficiency, not supply enough blood, because gu qi is the source of the blood, right? So gu qi is deficiency, not enough blood. So that have some, Shaoyang also have some like emotional things too, right? A bit depressed or like a little bit of anxiety, that we can still use this. So this one, liver qi stagnation and like a chaihu, bohe, blood deficiency, dangui baishao, qi deficiency, baizu fuling, and harmonizing the zigan chao weijiang. So this is another harmonizing formula, and with the heat sign, this is another question for the exam. So danji xiaoyaosan or jiawei xiaoyaosan. How can you tell there's heat or not? What is the good indication the patient is a heat or not? Is there anything more? So irritability can be just qi stagnation. Of course, there's a heat and is severe, more irritable than regular qi stagnation. And right tongue, excuse me, is like a qi stagnation too. But if there's heat, this depressive heat, then how the things are changing? How the tongue is going to change? How is the process going to change? Yes, process is slightly rapid. Our tongue. Rather side. So this is a good indicator that patient is depressive heat or not, right? So liver qi stagnation, just normal tongue. Depressive heat, become like a side weather. And possibly slightly yellow coating. And of course, like in terms of degree of severity, I have more severe irritability, like headache is worse, the bitter taste is bad, but just like the tongue and pulse, that is the difference between regular Xiaoyaosan and the Jiawei Xiaoyaosan is where you identify this heat. Okay, right. So yeah, Sunisan and Xiaoyaosan, both the liver and spleen disharmony. But Sunisan is pure excess with the heat. Minister fire, Xiaoyang heat is constrained. That makes this clumping qi make these frigid extremities, cold extremities. Whereas the Xiaoyaosan is mixed with excess and deficiency of the qi stagnation with the qi and blood. Okay, so if you differentiate, then is there any deficiency? The Xiaoyaosan is just pure excess, you see Nisan. Oh, yeah. Shen Chuya, can you read this page, please? I think you mentioned who said log back in. Okay, can I read? Actually, you come back. Can you read?
Yeah.
Go ahead.
Jiawei Xiaoyaosan, Chaihu Dengui Baishao Baizu Fuling Mudan Pi Zizi Zianchao Weijing Bohi spreads the liver qi, strengthens the spleen, nourishes the blood, and clears heat. For liver constraint with spleen deficiency that transforms into heat, characterized by irritability, short temper with possible tidal fever and sweating, red eyes, dry mouth, palpitations, lower abdominal pressure, difficult, painful urination, and increased menstrual flow of uterine bleeding. When it becomes visible, it will manifest particularly in the upper half of the body, leading to facial flushing or flushing of the earlobes. Children may present with mouth ulcers or swelling and distension of the breast and nipples.
Thank you. Yeah, because I don't know how, because my screen is different from yours. Yeah, so yeah, Jiawei Xiaoyaosan is just how I explained. You just add Mudanpi and the Jiji, the Danji Xiaoyaosan. So clear heat and that's from the Xiaoyang and the liver. But that's nothing really discuss further because we're not gonna ask on very detail. So just how can you differentiate between Xiaoyaosan, Jiawei Xiaoyaosan, and Sunisan? Okay, Sunisan, Jiawei Xiaoyaosan, similar because both have some heat. But Sunisan again is pure excess, with the Jiawei Xiaoyaosan has heat, excess, but deficiency together. All right. Thank you, Mia. So, Sherman, can you read this page, please?
Tongqi Yaofang, important formula for painful diarrhea. Tao Bai Zhu, Xiao Bai Xiao, Xiao Qinpi, and Fangfeng. Indication, recurrent problem of burgery, abdominal pain, diarrhea, and pain. Wiry, moderate, or wiry thin pulse. Pain before defecation with relief upon evacuation indicates constraint. Liver qi stagnation, overacting on the spleen, causing diarrhea with abdominal pain. Harmonize the stomach and intestines. Ban Chao Qi Qing Tong. Panela decoction to drain the epigastrium. Wanglian, all three, Banqia, Ganjiang, Wangqin, Rinshen, Daizao, Jigansao. Epigastric focal distension, full and tight with light or no pain, dry heaves or frank vomiting, boogers gums with diarrhea, reduced appetite, a thin yellow greasy coating, string-taut rapid pulse, stomach intestine qi disharmony due to a cold heat complex. 5 herbs are common with Chao Chai Hu Tong, Banqia, Wangqin, Rinshen, Daizao, Jigansao. P. Focal distension, syndrome due to clumping together of cold and heat.
Thank you. So, 通泻药方. So this is this is an important formula for painful diarrhea, and this diarrhea is caused by liver qi stagnation attack the spleen, and you're causing, because spleen cannot raise the qi, cannot transform, having this diarrhea, but the pain because the qi stagnation. So this is not caused by deficiency. This is caused by liver qi attack the spleen. So, and abdominal pain. So that's why Bai Xiao is there for helping the pain. And you have to move the qi in the middle jaw, so Chen-Pi, and tonify the spleen, and kind of drain dampness. Is Baiju. And the Fang Feng is known to treat this diarrhea due to wind. So what we call intestinal wind. So intestinal wind is this that usually that's the cause of the severe diarrhea. Fang Feng is a formula, herb for the wind, any wind. So you add Fang Feng to stop diarrhea. So yeah, that's true. So that the 通泻药方 is, just remember, this is abdominal pain due to liver attack the spleen, cause severe diarrhea. That's why chow. This chow is like absorb those these toxic bad pathogens, like this charcoal coil. This 通泻药方, just remember, liver attack the spleen, cause diarrhea with abdominal pain. You use 通泻药方. Another formula. Okay, all right. Yeah, thank you. So another formula for the diarrhea due to spleen qi deficiency is what? Diarrhea due to spleen qi deficiency is Shenling Baijusan. So Shenling Baijusan, however, is just pure spleen qi deficiency, cannot transform, having a severe diarrhea. However, 通泻药方 diarrhea is liver qi attack, so excess and deficiency together, right? So you should be able to differentiate, because Shenling Baijusan, they're not really having this severe pain. So Shenling Baijusan is more likely the phlegm and damp is they're causing this diarrhea. Not due to liver qi stagnation, but irregular diet like that. So that's the difference. So this is the harmonizing formula of the liver and the spleen. So a liver attack the spleen, stomach have some diarrhea, can be, or some have nausea, vomit, distension, and irritability. So Seni-san, Xiaoyao-san, Jiaowei-Xiaoyao-san, 通泻药方, this is all those harmonizing between liver and the spleen. So you should be able to differentiate those 5 similar formulas what's the difference between 小柴胡汤、四逆散、消药散、加味消药散 and 通血药方。Okay. And another harmonizing is stomach intestine. So one of the interesting formulas is 半夏泻心汤. So 半夏泻心汤 is 黄连, 黄芩, 2 very cold herbs. 半夏, the ganjang is all warm herbs, and the renshan 25 qi. So the signs and symptoms of 半夏泻心汤 is epigastric focal distension. Focal distension is P syndrome. So focal distension is that you feel something is obstructed. So like if you eat, let's say, for example, this is very common for bit deficiency patient, like some spleen, stomach, qi deficiency patient have some excess meat, like a barbecue. Then, even though the patient doesn't eat a lot, but feels something not good, like something's obstructed, but it's not full. Just it kind of nodded, right? So plum peach is a little bit different, I think, because this is focal distension is more not visible, but only you feel it. Only you feel it that something is kind of obstructed in the stomach, because you have a weak stomach, so your digestion is no good. So your stomach is kind of cold, but your food is, you intake the food is not digested. So it's kind of got stuck in the stomach, in the sensation of the focal distension. So full and tight with light or no pain. There's no pain, but just don't feel kind of cleared. It's got stuck. So then that makes obstruct the stomach qi going down, that have a dry hips and a frank vomiting. And also intestine didn't get this qi, they also have the borborygmus with diarrhea. So this is nausea, vomit, and the diarrhea, and reduced appetite. So this is food is stagnated, become rotten, so yellow, greasy coating. That's why we use the bansha and the huangyan, huangqin, like that, clear heat, the stomach and upper, and the string taut pulse and rapid pulse. Okay. So stomach and intestine qi disharmony due to cold and heat complex. So cold and heat complex is the patient is probably existing cold condition, cold stomach or deficiency yang, but the food patient intake is not digested, getting there, and turning into like a more rotten food and makes the heat sensation there. So this is in combination of the cold and heat complex, and they obstruct this the stomach and the intestine free flow of this food. So that you have going upper, vomit, nausea, and also at the same time diarrhea together. So vomit and diarrhea together, like sudden turmoil diseases, is this formula. And yeah, this is, instead of harmonizing liver and spleen, stomach, this is harmonizing stomach and intestine. So that's why about 5 herbs of the xiaochai hutang, like bansha, huangqin, renshan, dazao, ganzao is there. So this is what is the P syndrome, due to clumping together with the cold and heat. Any condition get the cold and heat, but what can be the cold and heat in the stomach? And most commonly, this is like a stomach cold patient having problem with digestion, and the food is gonna stagnate in the stomach for a while, become rotten, that generate heat with the phlegm, and that makes you focal distension. So this is And a patient feels nausea, not necessarily the vomit, but feeling nausea, no appetite, and having this distending sensation, focal distension, right? So not really bloated, but you feel something got stuck. So in that sense, yeah, as Sherman mentioned, like a more plump pitchy, like got stuck. So yeah, that's the 半夏泻心汤. Okay. Any questions so far? So plum peach is pure chi that feels like you got something got stuck. This 半夏泻心汤 P is like actually in material that's got something stuck. You have any questions here? So yeah, again, so you can have a heat herbs like Huangyan Huangqin, and hot herbs, ganjang, and tonify spleen and eliminate the phlegm. So stagnated food is like a phlegm. That's why Bao He Wan, Bao He Wan, they have urchin inside, right? Because that is more like considered as phlegm. That's why phlegm, like a food stagnation pulse, is a slippery pulse, just like a phlegm pulse. I think time is gonna be up in a minute, so yeah, we'll stop here, and then we'll meet you in another 10 minutes. Okay. let's continue. So maybe I told you before that prepare the board exam is try to know the name of this formula in each category, because they don't ask questions like wind, exterior wind color with harmonizing herb to choose. So if you know the name, I mean the category and the formula in that category, at least you can identify, if you see the case and you can identify the pattern, so this is bliss exterior, or this is like the liver chi attack the spleen, then your answer can be narrowed down to 2, most likely. So, I mean, I don't expect you to memorize all these things in detail, but at least which category formula are those formulas listed, and then try to identify the differences within that category. Right? So yeah, we have this like a release exterior wind and the purging and the harmonizing. So next is clear heat. So this clear heat is clear. We have a clear heat exterior wind heat that already covered. Now we're going to clear heat in the ing level, or chi level, or ing level, or indeficiency heat, or summer heat. So there's a lot of herb formulas in this category. Probably we're not going to use this formula a lot these days, because any excess heat, we probably use antibiotics or go to the doctor's office to get prescription, because that's more effective. But yeah, this is that formulas that we've been using for a long time to save life. So just understanding how they are formulated, and there's few formulas that I mean, that's also on the exam more than the others. See. Vincent, can you read this page, please?
白虎汤 White Tiger Decoction 石膏30 to 90 知母 9 四甘草 3 甘麦 9 to 15 Big 4 fever, pulse, sweat, thirst, and red face, irritability, aversion to heat. May also have headache, toothache, blooding of the gum and nose, excess, surging, rolling and or rapid. Yang Ming Jing Qi level heat, surging pulse, stop irritability, escapability, ice cold hand, and labored breathing, and 知母 add 色甘 is excess heat, add 薄荷 is kidney insufficiency heat, add 百合 is lung deficiency heat, similar to Tran-Bei.
Thank you. So yeah, Bai Hu Tang is the like a Shangan formula. So from the pathogenic factor is from Taiyang to Yangming. Then we have this 4 big, right? 4 big. So big fever, big pulse, big sweat, big thirst. And then this heat makes you red face, irritability, aversion to heat. And this is channel heat, right? This organ heat. Yeah, we already studied the Da Cheng Chi Tang or Xiao Cheng Chi Tang. So they are more organ heat. They're more deeper layer. So that's why pulse of the Da Cheng Chi Tang is deep and excess. Whereas the Bai Hu Tang is in the channel. So the channel condition like a toothache is Yangming channel, bleeding, or gums and nose. So this is all like a heat, excess heat in the Yangming cause bleeding and the toothache. The pulse is excess and surging, right? So one of the character of the Yangming channel pulse is a surging pulse. can be rolling or rapid. So yeah, mostly surging and rapid is the pulse for the Yangming. How is the tongue look like? What is the tongue of the Baihu case? That's correct, right? Yeah, red with yellow coating. It's getting older, then yeah, become dry. So yeah, red and yellow coating at the beginning. Yeah. So this is from Taiyang. It's no change to the Yangming. Yeah. Red tongue with yellow coating, and yeah, surging rapid pulse. If due to overdosage or wrong treatment, then may cause icy cold hand because the Yangming is getting too cold, and labored breathing is stop immediately. That's one of the side effects. And here, like Shigao is a typical Yangming herb, big dosage because it's mineral, it's heavy, so you use a large dosage, cook longer. And Jimu is a very versatile herb that you can use for excess heat with this one, or you can use indeficiency heat, like Hwangbai, Jibai Di Hwangwan, like Jimu Hwangbai. And the Jimu Bai here, you use like a long deficiency heat, like a Chuanbing. So, but yeah, that Bai Hu Tang, Yangming, channel heat. So remember the full big, okay? And the side effect is like this. And the next one is Juye Shigao Tang. So if mostly Shigao is there, that means more Yangming. Vanessa, can you read this page, please?
Yes. Zuye Shigao Tang, Shigao Dan Zuye Renshen Maimendong Bancha Zigan Chao and Gangmi. Indication: fever, profuse sweating, fatigue, vomiting, parched mouth and throat, thirst with desire to drink, irritability, nausea, and short of breath, stifling sensation in the chest. Red with dry, thin tongue coating, empty, rapid, thready pulse. Qi level heat, injuring the qi and fluid. 26. Qingying tongue. Xiniao Zhao, Xuanchen, Sheng Di, Maidong, Jinyin Hua, Len Chao, Huangnan, Dan Zuye, Dan Shen. Indication: high fever that worsen at night, severe irritability, restlessness, dry purple tongue, thready red pulse, heat entering the nutritive level. No more use Shigao, use 9 grams.
So Juye Shigao Tang is that we still have the Shigao as a chief herb, but a little bit of a tonification and the nourish in and some phlegmy thing. So because this is a fever, profuse sweating, but this heat is so intensive, a little bit like a more longer time, and patient become fatigued, and there is Yangming, so stomach is injured, so vomiting and parched mouth and throat, thirst with desire to drink, so it's still high fever, sweating and thirsty, but dry. Okay, so thirsty. So at the beginning it's just thirsty, but now there's gonna be this excess heat deplete the body fluid, become thirsty. So the qi level heat injures the qi and blood, qi and the body fluid, making this condition. So this is sometimes have like a low grade fever and sweating as well, because it's more like from qi level heat, just like Yangming. like whether we have a Yangming tidal fever. That Yangming tidal fever means that this heat is rising up more excessive between 3 to 8 o'clock, right? Between 3 to 8 p.m. because excess heat is hiding or warming the earth and emit this heat later. So there is kind of a 주의 시가오탕. So they are more like a consistent fever that the heat is lingering under the surface of the muscle. So this lingering heat depletes the body in and having this dry condition. So if you same excess heat like a big 4, fever, sweating, and thirsty, but pulse is not surging because its in is dry, so it's thready and rapid. So this is difference between the 바이후탕 and the 주의 시가오탕. Okay? So chi level heat, little bit the lingering, the heat is not go away, so that depletes the in and the chi, so having this condition. So that's the difference. Okay, and this is chi level heat, the formula, because the 바이후탕 and this 주의 시가오탕. And the next level, like ing level. Okay, so if you remember this 4 level, Wenbing 4 level, chi level, sorry, wei level, so wind heat, and chi level, like this Yangming heat, and the ing level. So there's a heat in the ing level, it's qing ing tang. Just name tells like clear heat in the ing level decoction. So yeah, sui niu jiao is water buffalo, so rather larger dosage. Before we use xi jiao. Xi jiao is a rhino horn, but that is endangered species. We don't use it anymore. So if we use xi jiao, they use 9 grams because they kind of shave this horn very thin and cook it. But instead, we use like about 10 times more dosage of this xi jiao to sui niu jiao. Xuanshen, Sengdi, Maidong, this is all clear heat in the ing level, and even then sometimes blood level. So a high fever that is worse at night because the severe ing deficiency or heat is in the ing level. Because again, heat is the ing level, that pathogenic factor is staying deeper in the ing layer, and your wei qi entering the inside. During the nighttime, there's big fight. So that's why it's a high fever at night. And the heat makes irritable and restlessness. Pulse is thready, rapid, and tongue can be purple because of this excess heat. Even though this is not yet blood heat level, can be a little bit stagnate the blood, so become purplish and dry. So this is heat entering the nutritive chi level. So this qing ing tang. Okay, so we have a 바이후탕, 주의 시가오탕, it's a chi level, and ing level heat, qing ing tang. And the next category is a toxicity, toxic heat. Let's see. So Shenchuya, can you read now, you think?
Can you hear me?
Yes.
Okay. Huang Lian Shui Du Tong Cactus decoction to relieve toxicity. Huang Lian 9. Huang Shin 6. Huang Bo 6. Zhi 6 to 12. High fever, irritability, a dry mouth and throat, incoherent speech, insomnia, dark urine, nosebleed, or vomiting blood, carbuncle, boils, dysenteric or jaundice, fire toxin in 3 joule and types: blood, damp, toxic heat, red tongue, a yellow coating, and rapid and excess pulse. ZZ sun joule clears the heat through urine, relieve irritability. Skin formula yin joule symptoms when heat, measles, boils. Xiao Feng symptoms when damp heat, weepy, long done, shui gan, tongue, damp heat in liver and gallbladder, genital area, huang lian, jue du tongue, toxic heat, boils, and carbonicles.
Thank you. Yeah, carbonicles. Thank you. So this is the toxic heat. So what's the difference between regular heat and toxic heat? In generally, yeah, toxic heat yeah, so yeah, of course, the toxic heat can be in the blood level, can be infection. One of the key symptoms of toxic heat is you get sick. You're sick. That toxic heat is one of the key characters. Patients get really sick. And second thing is, just like a fire, some solid things are manifested, like skin, ulcers, like carbuncles, boils. So not only blood level, you have a wind heat level, skin, or like the damp heat, liver and gallbladder, or this toxic heat in the whole layer. Because if our body has a heat, again, that heat tries to escape from the body to maintain the homeostasis. So that manifests as these boils, carbuncles, or measles, something that like a volcano, right? And so Huanglian Tang is that is 3 herbs is upper, middle, lower, right? Huanglian is middle jaw, stomach, and heart. And Huangqin is upper jaw and the lung, and Huangbo is lower jaw. So they can clear heat, damp heat, toxic heat together. So they can basically clear all the excess heat of the damp heat, toxic heat, blood heat in 3 jaw. So all over the body. And the Ji is for they enter the Sanjiao channel, so clear heat through the three jaws, upper, middle, lower jaws, by urination. So, yeah, if this is like those excess heat, have a high fever, of course, yeah, it's a real fever, like temperature is really high fever. Irritability, dry mouth and throat, incoherent speech. Incoherent speech is that, heat is in the yin and blood level, more likely blood level. But yin level heat also can have incoherent speech. Insomnia and dark urine, nose bleeding, so bleeding, carbuncles, boils, dysentery. So you can, it's more tangible things is coming from the toxic heat. So fire toxin in 3 jaw. So blood heat, damp heat, and toxic heat. And the tongue is red and yellow coating. If there's a dampness, the damp heat, then yellow and greasy coating. Right? And the pulse is excess pulse. So excess pulse means rapid, wide, slippery, and rapid. So here, like the together with the assist is Huanglian, Huangqin, Huangbai, Huangbo, GG is clear the heat through the urination, and very important for the irritability. So so this is like Xiaofeng. I mean, in Chaoshan is the skin rashes, measles, like early stage of measles because this is wind heat. So we use in Chaoshan. Xiaofeng-san, like a damp heat, wind damp heat. So we have like itchy, weepy, like redness, so like more like hives, like that. So this is wind damp heat. Longdan Shegantang, liver and galbal damp heat, like shingles, right? In the like hypochondriac area. And Hwangnian Jedutang, toxic heat, boils and carbon. So this is all like formulas for can treat the skin diseases due to heat. Right? And Xie Xintang. Ashley, can you read this Xie Xintang?
Okay, Zizintang. During the epigastrium decoction, Da Huang, Huang Jin, Huang Lian, fever, irritability, and restlessness, flushed face, red eyes, dark urine, constipation, and in severe case, delirious speech. Also, epigastric focal distension, jaundice, diarrhea, and dysenteric disorders, vomiting blood, or nosebleed, or swollen red eyes and ears, ulceration of the mouth and tongue or abscess, greasy yellow tongue coating or tongue and mouth ulcer, damp heat, excess with interior clumping, damp heat in MJ, Da Huang, drain fire, more than purging. Also, it enters blood level and treat bleeding, especially upper body. Huang Lian J Du T, drain versus Zizin T, purge.
Thank you. So Xie Xintang is pretty like Huang Qin and Huang Nian is there. So that means looks like the heat is more in the upper, and the Da Huang as a chief herb for the purge the heat. So it's pretty similar, like a fever, irritability, restlessness, and flushed face, red eyes, dark urine, but they have a constipation. And severe case of delirious speech. So this is heat in the blood level too. And also epigastric focal distension. So heat is clumping. Use the Da Huang means there's a clumping. Constipation, clumping. And possibly jaundice like that. So this vomit, blood or nose bleeding, this is heat in the upper, right? And swollen red eyes and ears. And ulceration of the mouth and the tongue or abscess. So this is all like a toxic heat in the upper. Greasy yellow tongue coating. So greasy yellow coating means damp heat. And what tongue and the mouth ulcer. Mouth ulcer is like, this is depends on where, but if tip is ulcer, or tip has an ulcer is more heart fire. The ulcer on the side is a liver fire. Also on the mouth is like a stomach fire. So excess fire can have this mouth ulcer or tongue ulcer. This is a damp heat excess with interior clumping. So interior clumping means that heat is severe that they become more like a kind of stagnant state that is not moving freely, make something more solid, tangible thing, right? Damp heat in the middle jaw. So this one different from the Hwangnian Jiedutang is Hwangnian Jiedutang use 3 jaws, upper, middle, lower jaw, and the Jiji that clear heat by urination, so drain. Versus Xie Xintang, this is even stronger. So they purge the heat, especially in the upper. Da Huang is very effective to purge the heat in the upper and stop bleeding, because this patient has a lot of bleeding in the upper. In this case, how long you going to cook Da Huang? cook longer, shorter, or same as the other herbs? The dacheng chitang, how did you cook the dawang? Right, the dacheng chitang, we cook dawang in the last 10 minutes like that, right? And what about this one, xie xin tang? Right, so last minute is purging effect. In this case, stop bleeding and more clear heat, cook normal. The cook same as other herbs. So you don't have to cook, you don't have to cook, add dawang last minute. Right, yes. So that depends on how you're gonna use the herb dawang. If you want to purge its main function for the constipation, the last 10 minutes. If you focus on the clear heat, or rather purge the heat and stop bleeding, you use cooking for normal with the other herbs. Okay, so the difference between 황년제두탕 versus xie is 황년제두탕, the clear heat of 3 joule, damp heat, toxic heat, and blood heat via urination. Whereas xie is more clumping, so have constipation and more bleeding, and use the purge using the dawa. Okay. And the next one is a Fuji Xiao Du In. Donna, don't you still school, right? So Dr. Chai is still lecture. Melanie, can you read this page, please?
29. Fuji Xiao Du Yin, universal benefit decoction to eliminate toxins. Huang Qin, Huang Yan, Nu Banji, Yan Chao, Bohe, Jiangkan, Xuan Shen, Mabo, Balangen, Zhijing, Gansao, Chenpi, Chaihu, Shengma. Indication: strong fever and chills, redness, swelling, and burning, pain of the head and face, inability to open the eyes, dysfunction of the throat, dryness, and thirst. Red tongue with powdery white or yellow coating and floating rapid and forceful pulse. Endemic toxin on the head with wind, heat, and damp phlegm, common in children and during winter or spring. Eliminate toxin with Huangyan, Huangqin, release wind, heat, and sore throat.
Okay. So this is toxic heat, but also have an exterior wind heat like epidemic. So kind of infectious diseases, having like a problem more in the upper because there's exterior wind heat, right? So they not only clear heat internally, they clear like a 뉴방지, the sore throat and toxic heat. This is lianqiao, sorry, typo, QIAO, lianqiao, bohe. This is all release exterior and the clear toxic heat, right? And the Xuanshen, Mabo, Banlangan, this is all goes to the throat. So this patient, due to infections like a wind heat, having all signs of chills and fever. So this is strong indication with the floating pulse that this is wind heat, right? Plus some toxic heat because they use a lot of these toxic herbs like lianqiao, the lianqiao, 뉴방지, xuanshen, mabo, banlangan. This is all like the toxic heat in the throat, the dysfunction of the throat. And the chaihu sungma is they bring all these herbs to the upper and release wind heat. So just remember, Fu Ji Xiao Du In. is epidemic toxic on the head with wind heat and damp and phlegm. But main signs and symptoms are this exterior chills and fever and floating rapid. So this is typical wind heat, tongue and pulse. I'm sorry, signs of the wind heat and then some toxic of swelling, burning pain of the head and face, the throat. Okay. Next is Liang-Ge-San. Mia, can you read this page, please?
All right. Liang-Ge-San, cool the diaphragm powder. Lian Chao, Da Huang, Mang Shao, Huang Qin, Gansao, Zherzi, Boha. Indication is for sensation of heat and irritability in the chest and abdomen, delirious speech, thirst, flushed face, and red lips, mouth and tongue sores, sore throat, swollen tongue, red eyes, nosebleed, constipation and dark scanty urine, red tongue body and edge with a dry yellow or white coating and a rapid, possibly rolling pulse, accumulated heat in the middle jaw and unformed heat in the upper jaw and formed heat in the lower jaw. This is a variation of Tao Wei Chen Chi Tong with Lian Chao as a chief herb.
Thank you. So Liang-Ge-San, this is a cooled diaphragm powder, and what diaphragm indicates is that they dealing with this heat in the upper jaw and middle jaw, or like middle jaw and so middle and lower jaw means below the diaphragm and upper jaw is above the diaphragm, because a lot of things happen in the upper, right? Because the first face, red lips, mouth and tongue sore, sore throat, swollen tongue, red eyes, nose bleeding. So that's why it says unformed heat. It's not like ulcer or like a boils, carbuncles. It's not like that. That is more accumulated heat. But this is unformed, just bleeding and some sores, sore throat like that. Plus the constipation and dark urine. That is accumulated heat in the middle and lower jaw. So this one used the Tiao Wei Chen Chi Tang. Tiao Wei Chen Chi Tang is like a organ and channel heat in the Yangming, right? So Da Huang and Mang Shao, and then clear toxic heat in Lian Chao, like that. So Liang-Ge-San is that. The character is upper as a heat, more like unformed heat, a lot of bleeding, sore throat, flushed face, thirsty, like that, red eyes, nose bleeding, and the lower jaw is constipation and dark urination. So this is like you can clear lower by the Chengqi-Tang and clear heat in the upper using those Lian Chao and the Huangqin, the Jiji. That that the Liang-Ge-San, Fuji Xiaodu in Xie Xin Tang, Huang Yan Jie Du Tang. Probably we're not going to use this formula in the clinic. I sometimes use Huang Yan Jie Du Tang, but Xie Xin Tang, especially called Fuji Xiaodu in or Liang-Ge-San, you're not really using the clinically. So next is the formula that simultaneously clear heat from the qi and blood level. So now the heat is penetrating from exterior to the qi level to the blood level. So this is more serious than the previous ones. This previous one is more yin level, but this is now blood level heat. Ruth May, can you read this one, please?
Yes, sir. 天文白毒饮，石膏、生地、黄连、犀牛角、栀子、桔梗、黄芩、知母、赤芍、玄参、连翘、甘草、牡丹皮。Cook 赤芍 and 犀牛角 first for 15 to 20 minutes. Intense fever, strong thirst, dry hives, severe and stabbing headache, extreme irritability, and in severe cases, delirious speech, rashes, and nosebleed. The tongue is dark red, and the lips are dark and scorched, and the pulse is either rapid, submerged or a thin or rapid floating in large pools. This is an epidemic toxin-borne pathogen disorder that manifests with severe failure in the qi and blood levels. Physicians should use the pulse as indicator for determining the appropriate dosage.
Okay. So this is a big formula. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, about 14, 15 herbs in there. Because they are dealing with multiple the like level, right? So Shigao and Jimu, this is for Baihutang, right? So they use a chill level heat, and they use Huangyan, Huangqin, those used for then Jizhi, like Huangyan Jiedutang, right? And then they use Xinyu Sengdi, Xuanshen, those Xijiao Di Huang Tang. So multiple formulas are combined here, right? So because this is what chill level, the pathogenic heat is entering chill level and penetrating to the blood level. So intense fever, strong thirst, dry heat, this is a chill level heat, right? And the severe and stabbing headache, extreme irritability, and severe cases, delirious speech, rash, and nose bleeding, this is blood level heat. Tongue is dark, red, lips are dark and scorched, pulse is either rapid, submerged, or thin, or rapid, or floating and large. So yeah, because this pulse is, they use, if the pulse is submerged, means submerged is deep, thin, and rapid, this is severe because they deplete the whole in and the blood become very thin and rapid, so use large dosage. Whereas a floating, large, and rapid, this is for Yangming, so it's less severe, so use a small dosage. And the pulse between is the two extreme requires medium dosage. So what it means is that if it is more like going deeper to the blood level heat, then pulse is deep, right? Going deeper inside, then you have a large dosage of like the more on this decoction. And if it's a still chill level surging pulse, rapid pulse, then less dosage because it's still on the chill level. While in between, then you use the like medium dosage. So that's one of the method to administer this formula. Okay. So again, Qing Wen Bai Du San is clear heat in the chill level and the blood level. So this is more like a Shang'an or Wenbing, this 6 stage or the 4 level heat. Now the clear heat from the organ formulas. Okay. Because this like the Wenbing or Shang'an formulas of the special heat, we're not really commonly use these formulas in the clinic, so we hardly use this formula these days. But organ formula, we sometimes use for clear heat, the organ. Centuria, can you read this page, please?
Ma Jing Shigantang, ephedra, apricot kernel, gypsum, and licorice decoction. Mahong, Shigao, Xingren, Zhigazao. Indication: fever, thirst, coughing, and wheezing, labored breathing, difficult to expectorate sputum, nasal flaring, heat lodged in the lung. Do I read the rest of it? Okay. Shui by sun, drain the white powder. Song by P, Dugu P, Z, Gonzal, Ging Mai, indication skin that feels hot to the touch, coughing and wheezing, sore throat, a dry mouth, little or difficult to expectorate, sputum, symptoms worsen in late afternoon, red yellow tongue coating, 3D and rapid pulse, constraint, long heat causing wheezing.
Thank you. So your 마싱 시간탕 is like heat in the lung, right? Heat lodged in the lung. So your exterior pathogenic factor penetrate the weight level, weight sheet, or wind heat entering through the nose to the lung, and this is organ heat. Right? So they're similar to those 바이후탕, fever, thirst, and like a big pulse. Probably can be sweating too. But another thing they have is cough and wheezing, labored breathing, difficult to expectorate sputum because heat, nasal flaring. Nasal flaring. So nasal flaring is like you boil the water in the pot, then this lid of the pot is kind of flaring, right? While the heat is going up. So that's like your nose is like the lid of the pot that this excess heat in the lung makes your nasal flaring. So 마싱 시간탕 is the variation of the 마황탕. Which herb is added and which herb is deleted from the 마황탕? Can you tell? So from 마황탕 to the 마싱 시간탕, right? So you delete guiz and add 시갈, right? So 식는 지간차 is there. So just substitute guiz to 시갈, make it for 마황탕 to 마싱 시간탕. So that is more like a chill level heat. So that's the 마싱 시간탕. To remember, this is from 타양 to 양밍, or weight level to chill level. Okay. And 시에바이산. 시에바이산 is the bai means white means lung, so clear heat in the lung powder. So your skin that feels hot to touch because there's heat in the lung. Your skin, lung governs the skin, so exterior is hot. And your cough and wheezing and sore throat due to heat in the lung, dry mouth, little or difficult to expect sputum, worse in the late afternoon. So this is a constrained heat that this means that this is a kind of background of indeficiency, okay? Because lung is the organ for upper jaw body fluid metabolism. If there's excess heat, then quickly drain the body fluid, and you're more likely indeficiency condition. So that's why the herb here is like 상바이피, 디구피, like the like indeficiency heat herbs, right? So that the differentiation point of this 시에바이산 and this 마싱 시간탕 is this is pure excess. However, this is more like a long-term heat in the lung, have more deep, making a little bit of indeficiency. So the tongue is red and yellow coating, but the pulse is red and rapid. And this is constrained lung heat causing wheezing and the background of indeficiency. And that herb is like indeficiency heat herb. So yeah, you should be able to differentiate between these two. So here, like 마싱시간탕인 시에바이산, both treat the wheezing and coughing due to heat, but difference is that 마싱시간탕 is excess heat from cold or heat. It means wind heat or wind cold, right? Whereas this is background of indeficiency that with a lung fire. So, and mostly used for the children because children is small container. They quickly drain the body fluid, so more like having this condition. So 시에바이산 herb is less stronger than the 마싱시간탕. Like 상바이피, 디구피 is rather mild, and gungmi is protect the stomach from the cold. Okay, and then next. Yeah, we got less than 1 minute again. So we'll take a break and continue after the break. Okay. Let's continue. So yeah, we have a heat in the lung. This is excess heat. This is like a rather mild heat under the background of indeficiency. And yeah, this is Xie Huang San. So it's up. The previous two was upper, and this is a middle jaw. Like that Xie Bai is. This is white, indicates the lung, and same here, Xie Huang San. This yellow indicates the spleen, right? So they treat clear heat from the spleen. Let's see who read last time. Vincent, can you read this page, please?
Xie Huang San, blend the yellow powder, 石膏、栀子、草黄蜂、藿香叶 and 甘草. Indication. Mouth under, bad breath, thirsty and frequent hungers, dry mouth and lips. Also for tongue thirst in children. A red tongue and a rapid pulse, and lurking fire in spleen. And 清胃散. 黄连 3 to 6, and 生麻 3 to 6, 丹皮 6 to 9, 生地 6 to 12, and 当归 6 to 12, and toothache, especially when the pain extends into facial swelling, fevers, bad breath, a dry mouth, a red tongue with little coating, and a slippery, large, and rapid pulse, and also indicated for blooding and sore of the gum, and for swollen, painful tongues, lips, or jaw. The painful areas respond favorably to cold and worsen with heat. A red tongue with little coating and slippery, large, and rapid pulse, and heat accumulation in the stomach due to overconsumption of rich or fried food or cold food, which constrains yang qi and transfers into fire.
Thank you. So Xie Huang San is the lurking fire in the spleen. Because this is spleen governs the tongue and like a mouth, right? Spleen governs the mouth and the tongue. Tongue is of course governed by the heart, but this is more like you for taste, you eat. So in that sense, your tongue, like especially under the tongue, your spleen channel spread under the tongue. So this is due to the heat in the spleen. Your mouth has a problem. So mouth ulcer, bad breath, thirst, frequent hunger, dry mouth and lips. So also tongue thrusting in children. So heat in the spleen can readily transmit the heat to the stomach. So this both like a stomach heat as well, like a bad breath and thirst, frequent hunger. This is more like a stomach. Mouth ulcer, dry mouth and lips, and the thrusting tongue. This in children is more like a spleen heat. This heat is because spleen is the like a more in organs, more delicate organ. Don't want to use a lot of cold herbs. So even though there's heat in the stomach, spleen, they don't use 황년. They rather use like a small dosage of shigao and also small dosage of jiji. But the big dose of fangfeng. So this fangfeng is to disperse like this, because spleen is earth, and if heat is in there, then it tends to kind of the lurking heat. The heat is hidden under the muscle layer. So using this fangfeng, you bend the heat. It rather than like clear purge, like clear fire. This is like a more safer for the spleen function. That's why there's a lot of like more than 100 grams of fangfeng in this formula. So again, Xie Huang San is clear heat from the spleen, like lurking fire in the spleen, and more focus on the tongue and the mouth. Okay, but not using like a drain fire. It's using like a dispersing the heat. But next one is Qing Wei San. So Qing Wei San is stomach fire, fire in the stomach. So use Huangnian, right? And also stomach fire cause the toothache, and especially when pain extends to the head. So this means like the stomach fire is following up the stomach Yangming channel and go to the like toothache, and this excess heat going into the like frontal or even the like a stomach 8 to 224, right? That's where stomach channel goes. So the pain is extended to the head. Facial swelling. Okay. Also, this is Yangming, right? Facial. Foul breath smell, stomach fire, dry mouth, red tongue with liquid coating, slippery, large, and rapid pulse. This is all excess pulse. Basically, this is excess. Indicate the bleeding and sore gums because stomach channel goes the gum. And swollen, painful tongue, lips, and jaws. The difference between these two is somehow similar, but this one doesn't really have a pain and also doesn't have a toothache, because toothache is more the gum issue. Gum is rotten, so have a toothache, decayed tooth. Whereas this is more like a spleen, so more tongue issue. So the Qing Wei San is toothache formula due to stomach fire. Right? And painful area respond favorably to cold. That means there is excess heat. Right? So this is heat accumulation in the stomach due to excess consumption of rich and fried food. This is all like heat and flame, damp. Well, cold food. Cold food eventually damages constrain the yang qi and transform the fire. But so regardless, there's excess heat in the stomach. Yangming have a toothache, the Qing Wei San. And the next one is Yu Nu Jian and the Dao Qi San. Vanessa, can you read this page, please?
Yunu Jian, Shigao Shudi Zimu Mai Dong Nuzi. Indication: toothache, loose teeth, bleeding gums, frontal headache, irritability, fever, thirst with a desire to drink cold beverages, red with yellow coat, superficial rolling, deficient and large, kidney yin deficiency with vigorous stomach fire. 37. Dao Qi San. Guide out the red powder. Mutong 3 to 6, Shengdi 15 to 30, Danzu Ye 3 to 6, Gun Kao Shao 3 to 6. Irritability with a sensation of heat in the chest, thirst with a desire to drink cold beverages, a red face, possibly sores around the mouth, dark, scanty, rough, and painful urination, or even blood urine, a red tongue and rapid pulse, heat in heart and small intestine. Shangdi enters heart and kidney.
Thank you. So Yu Nu Jian is this is both like a Qingwei San, Yu Nu Jian, both use the toothache. But Qingwei San is just excess fire in the stomach, whereas Yu Nu Jian is the underlying kidney insufficiency fire with the stomach fire. So this one is kidney deficiency. That's why it's a loose teeth, because teeth is what? Extension of the bone, and that is governed by the kidney. So remember, between the Qingwei San and Yu Nu Jian, same. They're toothache, bleeding gums, headache, frontal headache, irritability, desire to drink cold beverage. Both are like excess stomach fire. But the one difference is loose teeth, because that's only for the kidney insufficiency. So red with yellow coating, because this indicates stomach fire. Superficial rolling, but deficient. So that has some deficiency included. So it is difficult to identify, just like the tongue and pulse, but just one difference is loose teeth here. So instead of fire, like a clear fire Bangyan, they nourish in Sudi, the Jimu, right? Maidong. So yeah, to try to differentiate between Qingwei San and Yu Nu Jian. So Qingwei San is pure excess. So you have Huang Nian, Singma, and so that's the drain fire. Whereas Yu Nu Jian is more like Yangmi heat, plus the nourished kidney in. And the main difference is loose teeth. Okay. And Dao Qi San is typical like a hot fire, causing the urinary difficulty, the painful urination, because heat is transferred to the bladder, the small intestine to bladder. So this one, via the urination can clear heat from the heart. So because the heat is in the heart, irritability with the sensation in the chest, heat in the chest, because the stomach, hot fire or heat in the heart. Thirst with desire to drink cold beverages. So this is excess heat. A red face, possibly sore around the mouth. So this is all like hot fire. But has a urinary problem, dark, scanty, rough and painful urination, or even blood urination. So that means heat from heart to the small intestine. I have a pair, and then another pair of taiyang from small intestine, or hand taiyang to bladder, foot taiyang, so having urinary problem. So Dao Qi San, clear hot fire of Singdi, and drain the heat via urination of Mutong and Danjuye, and helping the irritability. So Dao Qi San is more like a children formula that children have some emotional problem, easily the agitated heart, and then they have this urinary problem. So this Tao Chi San case is also you see in the acupuncture point selection. So if you use the acupuncture for this patient, which acupuncture point is appropriate? Did you study this internal medicine in acupuncture? Hello, can you hear me? Okay, so there, like in Chem book, they have this specific point treating this condition, right? Remember? So using heart 5, heart 8, and blood 28 is comparable point of this Tao Chi San. Because the heart 5 is low connecting point, so transfer the heart to the small intestine, and then heart 8 clear fire from the heart. So the clear heart fire using heart 5 to transfer to small intestine, and bladder 28, the bladder of action point for the promote urination. So this is same function as Tao Chi San. Okay, and then so the first, this Xie Huang San, Qing Wei San, and the Yin is stomach spleen, healing the stomach spleen. So Xie Huang San is for more like a tongue issue. Qing Wei San is toothache, but pure excess using Huang Nian. There's Yin is underlying kidney insufficiency. So they have the loose teeth issue, but that is kind of a obvious differentiation point between the Qing Wei San and Yin. And Tao Chi San, this is heart fire, clear heart fire via the urination, right? And the next one, clear organ heat, is a Longdan Xiegan Tang, that famous Longdan Xiegan Tang, very commonly show up on your board exam. So, Melania, can you read this page, please?
Longdong Shigantang. Longdong Sao 3-9. Huangqin 6-12. Jiju Mutong. Chichenji Jie Chuhua or Chaihu, sorry. Shiding, Dangui, and Gansao. Pain and hypochondriac, headache, dizziness, red sore eyes, hearing loss, swelling in the ears, a bitter taste, irritability, short temper. Also difficult and painful urination, dark urine with heat sensation in urethra, swollen and puritic external genitalia, and foul-smelling leukorrhea. In women, short menses with reddish-purple blood, string-taut rapid excess pulse, red tongue with dots on the side and yellow coating, liver gallbladder attack upward, liver 2 for head, eyes, and ears, damp heat invading downward, gallbladder 34, genital area. Chaihu, guide other herbs to liver gallbladder channel, versus Jiawei Shayasan, not for full force of excess heat or heat excess.
Okay, thank you. So the Longdan Xiegan Tang is the damp heat in the liver and gallbladder. So this is more like a damp heat in the lower jaw, while liver 5 in the upper jaw. So Longdan Chao is the chief herb. They can clear drain, damp heat in the liver and gallbladder, and clear liver fire. And the Huangqin Jiji, they go to the liver and sanjiao channel, so clear heat in the liver and gallbladder. And Mutong Qi Qianzi Jixie, they promote urination, so clear damp heat through via urination. And Chai Hu is going to the sanjiao channel, liver channel clear heat, and the Sengdi Dangweis protect those harsh properties, getting damage, too much damage to the qi and the blood. So this is a liver and gallbladder damp heat, so have some issue in the hypochondria, right? And headache, this headache means like a Shaoyang headache, so temporal headache. And dizziness, this liver fire goes up, you feel dizzy. Red and sore eyes, this is all excess heat. Hearing loss, that liver fire, this is acute excess condition. So you have a high-pitched tinnitus or have a sudden loss of the hearing. That's possible. So this is more like a liver fire go up. So problem is in the upper. And the swelling in the ears, including the swelling in the ears, and the bitter taste, irritability, and short temper. So this is all more like a liver fire. And then the damp heat in the lower jaw, so difficult and painful urination, dark urine, because the heat, damp and heat, heat makes like a dark, dampness makes difficult and painful. Heat sensation in urethra, because liver and gallbladder channel goes to the genitals. So a lot of problems is caused by liver and gallbladder damp heat, very similar to the damp heat in the bladder. And the swollen and pruritic external genitalia, and the foul-smelling leukorrhea. So foul-smelling leukorrhea is a damp heat leukorrhea. In women, short menses with the reddish purple blood. So short menses means heat, and the reddish purple blood means like this heat can be stagnated. So more like a blood stasis is likely, not exactly blood stasis. And the string taut and rapid pulse means like this liver and the heat, excess pulse. Red tongue with dots on the side. So dots on the side is excess heat on the side. And yellow coating, more yellow greasy coating because dampness. So liver and gallbladder attacks the uppers. So your comparable point is liver 2. So goes to head and ears and eyes. And damp heat going downwards, its comparable point is gallbladder 34. A clear damp heat in the liver and gallbladder. And the Chai Hu is the guiding herb, other herbs to the liver and gallbladder, so you're not going to use a lot. So this is liver and gallbladder damp heat, excess heat. Liver fire with damp heat in the lower jaw. Whereas Jiaowei Shaoyasin is underlying spleen qi deficiency with the blood deficiency and heat. So this is excess and deficiency combination. Whereas Longdan Shigantang is pure excess. So again, Longdan Shigantang is upper condition of like a headache, tinnitus, hearing loss, like that, and bitter taste in the mouth. Whereas if it goes to the lower jaw, it becomes urination problem. Right? And so now we have a fire in the heart, fire in the lung, fire in the stomach and spleen, fire in the liver and gallbladder, and this is like a liver and the lung. And let's see. Mia, can you read this too? Zhu Jinwan and Xiao Yao Tang.
Luo Jinwan, left metal pill. Huang Lian, Wu Zhu Yu. Indication is for acid reflux, bitter taste, belching, vomiting, indeterminate hunger, epigastric vocal distension, dry mouth. red with yellow coating, rolling, string, taut, rapid, excess pulse, liver fire causing liver and stomach disharmony, in excess, sedate the sun. Huang Lian is 6 times more than Wu Zhu Yu. And then Xiao Yao Tong, Xiao Yao Dan Gui Gan Sao Mu Xiang, Bing Lang, Huang Lian, Huang Qin, Da Huang, Ro Gui. Indication is abdominal pain, difficult defecation, equal amount of pus and blood, tenesmus, burning sensation around anus, heavy sensation in the body, dark and scanty urine, greasy, slightly yellow tongue coating with a rapid pulse. This is dysenteric disorder due to damp heat lodged in the intestines, where it causes the qi and blood to stagnate. This condition is frequently associated with food poisoning or the contraction of an epidemic toxin.
Thank you. So Zhu Jin one, this is left metal. So left is liver, metal is lung. So yeah, this is like a acid reflux, bitter taste, belching, vomit, indeterminate hunger, epigastric vocal distension, dry mouth. So this is liver fire attack the stomach. Liver fire attack the stomach. And having this the acid reflux, bitter. So acid reflux is caused liver attack the stomach. Bitter taste is because of the liver fire, right? And belching, vomiting. This is all like a liver attack the stomach, liver fire attack the stomach. And so tongue is red and yellow coating, indicates the excess heat, and the rolling string taut, rapid excess. So basically it's excess person. The liver fire causing liver and stomach disharmony. So this one is using the 5 element in excess. So yeah, liver is excess and sedate the sun. So clear fire the heat in the heart, so fire, right? So use the Huangnian. So yeah, 6 times more dosage of Huangnian than Wu Zhu Yu. So Wu Zhu Yu is they go to the liver, like Wu Zhu Yu goes to the liver channel to the protect headache. But this is hot. Huangnian is cold. So they use cold and hot. So Huangnian clears the fire. Huangnian clears the fire from the liver, whereas Wu Zhu Yu is actually warming, but it goes to the liver channel. So that brings the Huangnian, this cold property to the liver, so clear fire from the liver. At the same time, these warms protect the stomach because Huangnian is too strong and large dosage. So yeah, Wu Zhu, so they are well balanced of just 2 herbs, but they can clear liver fire. And yeah, that helps the stomach because Huangnian clear fire from the stomach and descend the qi, and Wu Zhu Yu also that protect the stomach and descend the qi, helping those nausea, vomit, indeterminate hunger like that. So remember the Huangnian is 6 times more than Wu Zhu Yu. So Wu Zhu Yu like 3 grams and Huangnian 18 grams like that. And using this 5 element is that the wood is in excess and sedate the sun, means fire. That they use this 5 element theory to clear fire from the liver. That Longdan Shirantang also fire, but this Longdan Chao doesn't have a function like a Huangnian that can clear heat in the stomach. Longdan Chao is only go to the liver and gallbladder, whereas Huangnian is clear heat in the stomach due to the liver fire attack. Okay? So this is liver and stomach disharmony, but more liver fire and the stomach disharmony. Xiao Yao Tang. So Xiao Yao Tang is dysenteric. Yes, the dysenteric is what? there's a blood and pus in the stool, right? There's diarrhea with blood and pus due to the toxic damp heat. So it's something really bad like that. So Xiao Yao, this is like a Xiao Yao. Even though the chief herb is Huang and Huang Qin, they clear heat, damp heat, but Xiao Yao, Dang Wei, Gan Chao, so they can moderate those from this harsh property of Huang Nian, Huang Qin, Da Huang. So this is abdominal pain, difficult of defecation, equal amount of pus and blood, tenesmus. So this is all like a dampness, and burning sensation is heat, heavy sensation in the body. So basically Xiao Yao Tang treats the dysenteric disorder with damp heat. And this is equal amount of damp and heat. So there's both equal amount of pus and blood, means heat and the dampness is almost same. So that's the character of the Xiao Yao Tang. The reason why I'm emphasizing this is that we're going to compare this to the next formula, same dysenteric disorder, Bai To Wang Tang. So see how these two are different. Ruth May, can you read this page, please?
Bai To Wang Tang. Bai To Wang 6 grams, Huang Lian 9 grams, Huang Bo 9, Qin Pi 9, abdominal pain, tenesmus, a burning sensation around anus, diarrhea containing more blood than pus, right tongue with yellow coating, string-topped, rapid pulse, heat toxin in stomach and intestine, Juyin stage dysenteric disorder due to damp heat or toxin in the blood level. Bai To Wang is the principal herb for dysentery and benefits eyes and treat damp heat, especially blood level. Clear heat from deficiency, 青蒿鳖甲汤, 鳖甲 15, 青蒿 6, 生地黄 12, 知母 6, 丹皮 9. Night fever and morning coolness without sweating as the fever recedes. Emaciation without loss of appetite. Right tongue with little coating and thready rapid pulse. Late stage of warm fever disease or AIDS. 鳖甲 yin level, nourish yin, 青蒿 vendor heat.
Thank you. So Bai To Wang Tang versus Xiao Yao Tang that we just discussed. This Xiao Yao Tang and Xiao Yao Tang dysenteric with equal amount of pus and blood. Bai To Wang Tang dysenteric, but they have more blood than pus. That means the heat is more extensive. Right, there's more blood than pus. So Bai To Wang Tang is actually like late drain stage, means pretty bad, because this is almost like a the live and death situation if a patient is in the drain stage in Shanghai. I mean, these days we're not really seeing this type, but this is drain stage dysenteric disorder due to damp heat or toxic heat in the blood level. So this damp heat is deep rooted in the blood level. This heat causes this dysenteric disorder with more blood than pus. I remember Bai To Wang Tang here, like Bai To Wang. Bai To Wang is dysenteric, main herb for dysentery, and also they benefit the eyes somehow. So this is the difference between Xiao Yao Tang and Bai To Wang Tang. And now, so this is all basically excess heat. Some formula with clear heat from deficiency. So Qinghao Biejia Tang. So Qinghao Biejia Tang is very unique manifestation. Night fever, morning coolness. Excuse me. So this is because this is yin level heat. So yin level heat of Wenbing. So here, like a late stage warm febrile disease means the yin level heat, right? So heat is in the pathogenic factor is a yin level, and your weight enters the yin level at nighttime. There's a big fight. So there's a night fever. But in the morning, this weight is popping out to your eye, bladder 1. You wake up, right? And that's why you wake up. No more coolness. That's morning coolness. The morning, all the fevers is gone, but nighttime you have high fever. So very unique. This choosing fever thing. Without sweating, as fever recede. So your nighttime you have a fever like night sweating, all these things, but the morning is all become normal. But you're very emaciated without loss of appetite. So without loss of appetite, they said this is. If it's a chill level heat, then there's no appetite. But this is yin level, so there's no appetite lost. So that is the character of the Qinghao Biejia Tang. There's like a Biejia is heavy, strongly nourishes the yin, whereas Qinghao is light, but strongly vent the heat in the yin level. So Biejia brings the Qinghao to the yin level and let it go. So Qinghao vent the heat from the deep yin level, and the Biejia nourishes the yin level, nourishes the yin that have like root cause of this yin level heat. So Qinghao Biejia Tang, night fever and morning coolness. Okay, and the Mudanpi is for the deficiency heat due to without sweating. And next, indeficiency heat is these two. Shenchuria, can you read this page, please?
Chingusan, cool the bones, powder, yin, chahu, zumuhu, huang lian, degu pi, qing hao, qing zhao, zubajia, ganshao, indication, afternoon tidal fever, unremitting, chronic low-grade fever, sensation of heat in the bones, but flesh is not warm to the touch, irritability, insomnia, lethargic red lips, dark red cheeks, night sweats, thirst, dry throat, emaciation, red with little coating, thready and rapid pulse, kidney, liver, yin deficiency leading to steaming bone disorder, Dongui, Bui, Huang Tong, 6 yellow decoction, Tong Gui and 6 yellow decoction, Dongui, Xing, Dai Shu Dai, Huang Lian, Huang Shin, Huang Bo, Huang Qi, fever, night sweats, red face, dry mouth and parched lips, irritability, dry stools, dry and scanty urine, a red dry tongue and a rapid pulse, night sweating due to kidney yin deficiency, fire, sweating stops with wake up.
Okay. So Qingwu-san, they are named as cool the bone powder. So what do you mean the cool the bone powder? This is for steaming bone disorder due to severe yin deficiency. Because that yin deficiency is so severe that it goes to the bone level, and the patient feels like that there's a heat from the bone. So this needs like a strong nourish in and clear heat in the in level. So in chai hu huang nian, digupi, qinghao. This is all like in-deficiency heat herbs, right? So they put all together and also nourish the in, so BHI is there. So this afternoon tidal fever. So afternoon tidal fever is indeficiency. Afternoon tidal fever usually means indeficiency heat. This don't get confused with Yangming tidal fever. Yangming tidal fever is more high fever. This afternoon tidal fever is rather like a low-grade fever, between the 3 to 6. And the unremitting chronic low-grade fever and sensation of the heat in the bone, but flesh is not warm to touch, so it is more deeper. And this deficiency heat makes irritability, insomnia, lethargic, red lips, dark cheeks, night sweat, like that. So this is tongue is red with no little coating and the thready rapid pulse. So this is typical indeficiency heat pulse. Okay? So kidney and liver indeficiency leading to the steaming bone disorder. So remember, this is like the sensation of the heat in the bone level. Okay, and all the others you cannot differentiate because they are all indeficiency. But especially they go to the feeling this sensational heat in the bone. Right? And Dang Gui Liu Huang Tang. So Dang Gui Liu Huang Tang is what we have Shao in heat type formula. That kidney indeficiency is so severe that this is indeficiency fire. Okay? So the Dang Gui Liu Huang Tang. So they have 6. Liu means 6, right? 6 yellow with Dang Gui. So 3 yellow is clear heat, like Huang Nian, Huang Qin, Huang Bo. Remember this? Like this Huang Nian Jeju Tang, Huang Nian, Huang Qin, Huang Bo, clear heat from the 3 jowls. And so not only clear heat, but the root cause is indeficiency. So add Sungdi and Sudi as some Dang Gui, but Sungdi, Sudi, another like Huang, Sungdi, Huang, Sudi, Huang. And Huang Qi. Huang Qi is important herb for stop sweating, right? So that's why named Dang Gui and 6 Huang Tang, Dang Gui Liu Huang Tang. Because severe indeficiency fire, feverish sensation, night fever, red face, dry mouth, irritability, dry stool, dark and scanty urination. But night sweating is very severe. Even that leads to the daytime sweating too. So this Dang Gui Liu Huang Tang treats the excess sweating, night sweating due to indeficiency fire. So red, dry tongue or no coating with rapid, thready pulse. So this night sweating due to kidney indeficiency fire. And sweating stops with wake up because this night sweating is what we call thief sweat. So you wake up, then this gone. So this is Dang Gui Liu Huang Tang. Remember this is kidney indeficiency fire and treats the sweating. So some menopause patients have suffering from severe sweating, sometimes day and night. So you use Dang Gui Liu Huang Tang. But the problem is this is so strong, like very cold herbs there. So patient is kind of a deficiency underlying of qi or blood. You have to be careful. So this is more like a little bit strong formula. Okay? And the last one, okay, 2 minutes. Let's finish this. Sherman, can you finish this, please?
Louis San, 6-1 powder. Huexia, Ganshao, 6-1. Indication: fever, sweating, thirst, irritability, urinary difficulty, diarrhea, nausea, and vomiting. The formula also treats a range of other presentations, including painful urinary dribbling and stony, painful urinary dribbling due to damp heat in the bladder and damp heat skin disorders like papules, sores, and prickly heat. A thin, yellow, and greasy tongue coating, and a soggy rapid pulse. 6-to-1 ratio between waist shear and Gansau. The cock and cheesecloths, stomach heat or damp heat in the lower jowl.
So this name is Liu E61 powder. So Huashi and Gancao, like a 6-to-1 ratio. That Huashi is slippery, so they promote urination, and by urination they eliminate the dampness with heat. Right? It's cold and slippery. So yeah, they like a fever, sweating, thirst, irritability is like a like summer heat, damp heat, right? And urinary difficulty, diarrhea, nausea, vomiting this is all damp heat in the middle and lower jaw. So yeah, this formula treats the painful urinary drip. This is like the dampness in the bladder, right? And probably this is due to summer heat. So that's why you use a Huashi. So yeah, summer heat or dampening the lower jaw. Okay, the ratio is 6-to-1. This is important to remember. And Huashi you have to decoct in the cheesecloth. Okay, so that's it for today.